Good morning, everybody. Welcome to Our Chicago. I'm Terrell Brown. This past week, both the state of Illinois and the Biden administration declared monkeypox a public health emergency. More than 7,000 cases have been diagnosed across the U.S. Hundreds of those are right here in Illinois, which is in the top 5 states with the most infections. And while there is a 2-dose monkeypox vaccine, the demand outpaces supply. Chicago health officials have made getting more people that first dose their priority. Dr. Kathy Kretikos, Director of Infectious Diseases with Howard Brown Health, one of the country's largest LGBTQ+ organizations, and Massimo Pacilli, Deputy Commissioner for Disease Control at the Chicago Department of Public Health, are with us. Nice to have you both. Good morning to you.
Good morning.
Good morning.
Deputy Commissioner, I'll start with you. We know that monkeypox is not something new, but it's widespread now. Do we know why?
Yes, that's right. We have known about monkeypox for some time, since the 60s, really. And in advance of 2022, the disease has been primarily observed in endemic country of Central and West Africa. And so outside of those areas, we would observe, let's say, 0 to 2 cases a year nationally here in the U.S. So a very rare disease outside of those endemic countries.
Dr. Kretikos, that said, is monkeypox tough to actually contract?
Well, monkeypox can be spread through direct contact with infected lesions. And so if you do come into contact with those lesions, it certainly can be spread that way. And it's relatively easy through direct contact. However, it's not through casual contact. So if you brush up against somebody who may have an active lesion, that's not adequate. It's really more hugging or physically being in close contact on a sustained basis. That said, within social groups, especially people who are congregating in very close situations, having intimate contact, having family members in very, very close physical contact on a frequent basis, that would be how it would be transmitted.
Infected lesions, you mentioned those. Is that the main symptom of monkeypox? Can that be serious?
So the course of infection with monkeypox generally starts out with more general symptoms such as fever, body aches, sometimes swollen glands, lymph nodes, we call them. And then at some point, the lesions start to show up, erupt. You can have an initial lesion at the initial point of contact as well, or you may get a crop of lesions where you're first infected, and then you get lesions that spread across the body. And when we say lesions, they really do look like a special type of skin lesion. It goes through a period of transformation from where they start out as more like a pimple and then evolves into a vesicle with a little fluid in it, and then evolves to more of a pustule, then gets a scab and falls off. And unfortunately, through that entire time period, the lesions are contagious.
And how long generally is that time period?
That can last for several weeks, so typically about 3 weeks. And you are continued to be considered infectious until the scabs fall off and new skin has formed underneath.
Commissioner Pacilli, the governor declared monkeypox a public health emergency here in Illinois, we know. How does that help you in your effort? What does that look like?
Yeah, that's right. The state and now the federal emergency public health declarations really bring up the import of the attention that we need in order to respond to the ongoing spread of monkeypox. And here in Chicago, so broadly, this allows for enhanced procurement and of vaccine therapeutics, distribution of these indispensable asset to response to the outbreak. In Chicago, we have some of these capacity as baseline, and we have been distributing vaccine to providers like our partners represented here, as well as facilitating clinicians who need access to therapeutics to care for their patients. But these important declarations allow for enhanced capacity to respond with additional funding, support, and attention to that which we need to raise awareness, inform preventive measure, and then raise the immunity of our communities by vaccinating more of those who are at risk.
Dr. Kretikos, Massimo Pacilli, Deputy Commissioner. Hang on for 1 second. We're going to take a quick break. More of this conversation when we come back.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.